Okay, so the acetic derivative NSAIDs we will discuss are diclofenac, ketorolac, and indomethacin. So diclofenac is commonly used everywhere because of its analgesic, antipyretic, and anti-inflammatory activities. It is considered to be more potent than all the other NSAIDs. It is non-selective during the early phase after administration, but eventually, in the later phase, as plasma levels decrease, it behaves like a COX-2 inhibitor. It is approved for use in rheumatoid arthritis, osteoarthritis, pain, primary dysmenorrhea, and acute migraine. So it is usually given orally, but it can be given IV for acute pain like migraine. Adverse effects are particularly gastrointestinal effects in general. No? Hypertension and myocardial infarction profiles are similar to that of COX-2 inhibitors. So here in the Philippines, common brands include Cataflam and Arthrotec. Ketorolac is potent as an analgesic, but it is not as potent as an anti-inflammatory drug. Its use is limited to 5 days or less for acute pain, and it can be given orally, IV, or intramuscularly or IM. There are also intranasal preparations actually. It is widely used for acute pain after surgery, and it has been used to replace morphine. No? But it should not be used for routine obstetric analgesia because it can affect the fetus adversely. A common brand is Toradol. Okay, so indomethacin. So it is also another potent COX inhibitor. And it inhibits the motility of polymorphonuclear leukocytes. It lowers the synthesis of mucopolysaccharides, and it also may have a direct vasoconstrictor effect. It is actually estimated to be up to 20 times more potent than aspirin, but the high percentage of adverse effects limits its use. No? So aside from headaches, dizziness, confusion, GI ulceration, and bleeding that could be fatal, there also have been reports of psychosis, hallucinations, and even suicide. It was used for moderate to severe arthritis, the plural of arthritis. No? So rheumatoid arthritis, osteoarthritis, and also ankylosing spondylitis and acute gouty arthritis. But it is not used very much now, again, because of its side effects. Except when it is used for the closure of persistent ductus arteriosus in premature infants. Now, the ductus arteriosus, if you still do not know, is a normal structure in the fetal circulation. Okay, it allows blood to flow between the aorta and the pulmonary artery. So why? Of course, the fetal lungs are not yet working, no? So that's why blood from the baby's lungs should be diverted from the lungs into the circulation to receive oxygen from the mother's circulation. But of course, the ductus arteriosus is expected to close shortly after birth. Okay? Because once the baby's lungs are now functioning, there is no more need to divert the baby's blood. If this does not close, however, extra blood gets pumped from the aorta in the pulmonary arteries, no? Increasing unnecessary workload in the heart and the lungs. And this causes pulmonary congestion also. Large PDAs or patent ductus arteriosus are usually corrected by surgery, but small ones can be corrected by this drug. The side effect to watch for in neonates, though, is renal toxicity. Now we go to the propionic acid derivatives, which are ibuprofen and naproxen. Generally, they are non-selective COX inhibitors with effects and side effects common to other NSAIDs. They are also usually used for treatment for mild to moderate pain, headaches, primary dysmenorrhea, and the arthritis. Okay, so first, ibuprofen. Ibuprofen is also a common NSAID. So tablets, capsules, and gel caps and oral suspensions are available over the counter. The usual adult dose is 400 milligrams every 4 to 6 hours as needed for pain. An injectable preparation is also available for patent ductus arteriosus closure also. It has a similar profile to indomethacin, but compared to indomethacin, it decreases the urine output less and it also causes less fluid retention. Okay, common brands of ibuprofen. You have Advil, Dolan, Midol. No? It is also present in combination with paracetamol in Alaxan FR. Alaxan FR. Okay, naproxen is available in tablet form, caplet, gel caps, and also for oral suspension and suppositories. Okay, it is indicated for juvenile and rheumatoid arthritis, osteoarthritis, acute gout, primary dysmenorrhea, tendinitis, bursitis, and general acute pain. There is an increased risk for toxicity in the elderly, so dosage may need to be adjusted. It is usually given 250 milligrams per dose 3 times a day. Okay, common brand Flanax. Okay, mefenamic acid is another common NSAID. It is under the phenamates class. They are typical NSAIDs. Okay, it is used in the short-term treatment of pain in soft tissue injuries. It can also be used for dysmenorrhea and the common arthritis, rheumatoid and osteoarthritis. It is not recommended for children and pregnant women. Okay, common brands Dolfenal, Gardan, and Ponstan. We also have the enolic acids or the oxycams. So these are similar in efficacy to aspirin, indomethacin, and naproxen for long-term treatment of rheumatoid or osteoarthritis. The advantage of the oxycams is their long half-life, which allows once-a-day dosing. So piroxicam is a non-selective oxycam or enolic acid. It has the longest half-life. The usual adult dose is 20 milligrams once a day. Okay. Common brand Feldene or Feldene Flash. It's a difference. Feldene is capsule, Feldene Flash is tablet. And then you have meloxicam. Despite not being developed as a COX-2 selective inhibitor, it was found to have COX-2 selectivity, which was comparable to celecoxib. So thus, it causes less gastric injury compared to piroxicam. The adult dose is 7.5 to 15 milligrams, still once daily. Common brand Mobic.